Does mental health always slip off the agenda, and how could we do it differently?
Well, without doubt, mental health has been the poor relation of the NHS in the first 63 years, and probably that's because it was always a separate system, even predating the NHS. So when the NHS was set up, it just inherited that culture of separateness. And it was probably okay in the last century when, in a town like Leigh, mining town, the dangers here were physical. You know, people had poor housing, air quality was poor, and life underground was pretty tough. So you had no choice but to lock arms together and look after each other and fight together for each other. And that culture then very much was carried over into the streets above the mines. A physically dangerous place, but emotionally very secure. And what we've seen, the change we've seen in all communities as we've gone from the 20th to the 21st century is that turned around. Life's probably become more physically safe, but emotionally less stable. We're all living much more stressful, isolated, unstable lives where we can expect to have, well, at least 10 jobs in our lifetime, where challenges are thrown at us every day. People are juggling with families and work responsibilities, and the result of that is that we need better mental support. You know, we can't have an NHS going forward that has the physical over there and the mental over there, mind and body in different places. We need a system that is very much about the whole person, and that's why I am arguing, as we renew Labour's health policy, to place mental health at the heart of a 21st century NHS. It has to happen, because if we don't make that change, we will continue to pay the social price for failing to look after people's good mental health. So a huge challenge, not just for the party, for the country, but I've made a very clear statement of intent to put mental health policy at the heart of health policy as Labour renews in opposition.